Are you using dilators in order to help you overcome pain with intimacy, but it still hurts? If that's the case, I want you to stop and rethink how you're using the dilators because they may actually be working against you at this point, and I'm going to explain why. Pain with the use of dilators is never okay because when you are using dilators to train your muscles not to protectively guard, you are trying to overcome pain with intimacy. You're trying to teach your brain not to protectively guard when you are being intimate. And if you feel pain while you're using the dilator trainers, you may actually be reinforcing that painful pattern. There are 3 criteria that I want you to think about when using dilators. Number 1, no pain at all. It's gotta feel comfortable. The only thing you should feel is maybe a little bit of pressure and stretching, but not pain. And that's because we gently want to expose your tissues to graded exposure and desensitization in a way that will allow your muscles to stretch and your brain to learn that it doesn't have to protectively guard and it must be non-painful. Otherwise, you're reinforcing that pain pattern, which we want to overcome. And of course, we would never want to do that. The second criteria is it's got to be non-threatening. You have got to feel safe in how you're using the dilators, the size of the dilators you're using, the environment that you're using it in, because one of the things that we're trying to train is that neuromuscular reconnection and let the brain know that it can work with the pelvic floor and it doesn't have to be protectively guarding. So no pain, it's gotta be non-threatening, and thirdly, you've gotta feel in control. You've gotta control the pace of progression of the dilators because we want to do it in a way where you're progressing incrementally in a way that feels safe and non-threatening so that you can overcome the pain with intimacy as you progress dilator sizes. Because remember, the way dilators work is that it gradually stretches the muscle while teaching the brain that it doesn't have to protectively guard. If you are experiencing pain with intimacy and you're using dilators, I would strongly recommend that you do it under the supervision of a skilled pelvic floor PT. We can help guide you in the most successful way. And I want you to know that although pain with intimacy is common, it's not normal and you are not alone. There is help. You can overcome it. You can get to a place of joy and enjoyment with intimacy. If you appreciated this video and if it was beneficial, please go ahead and subscribe so you don't miss any other amazing videos. Like, follow, and of course, ask me any questions you have in the comments below. I'd be happy to answer.